Good morning friends. Today we'll be talking about medial epicondylitis. Medial epicondylitis is also called as a golfer's elbow. It is also called as a pitcher's elbow. What is the location? So location is on the inside of the elbow. So this is the medial epicondyle, and the pain syndrome which is surrounding this medial epicondyle is called as a medial epicondylitis. It is an overused tendinopathy of the common flexor origin. So there are four flexor muscle, the pronator teres on the top, then flexor carpi radialis, then palmaris longus, then flexor digitorum superficialis. These four muscles are supplied by the median nerve, and then there is a flexor carpi ulnaris which is supplied by the ulnar nerve. So these five flexor muscles form a common flexor origin which origin around the medial epicondyle. So approximately for initial 3 centimeters, it's a common flexor origin, and this is the site which is inflamed in cases of a medial epicondylitis. Now medial epicondylitis is more commonly seen in middle age group like 40s to 60s. It is more common in females as compared to males. It is more common in sportsman population, specifically the pitchers, those who are playing racket sports, those who are playing golf, those who are doing bowling, those who are doing rowing. So these sports are predisposing to this condition. Also, this condition is more common in those patients who are doing continuous labor work with the elbow. So in laborers also this syndrome is very common. Now it is increased by some pre-existing conditions like diabetes, smoking, obesity, and as I told you, repetitive function or repetitive activity. If you are doing some labor work which is doing repetitive motion of the elbow, that may also increase it. Now as I told you, it is the origin of the common flexor mass. So this symptomatology is exacerbated by the flexion and the pronation of the wrist. So this and this activity, the flexion and the pronation activity of the wrist, will increase the symptoms. So there are two tests that we do. One is an active golfer's elbow test, in which we make the elbow extended and then try to forcibly flex the wrist along with some pronation. So that will increase the symptoms of pain. This is an active golfer's elbow test. And you can do a passive test in which you can actually extend the wrist to actually do an extension effect on the golfer's elbow side. So that will cause more stretching and increase the pain. So there is an active golfer's elbow test and a passive golfer's elbow test. Now as far as the treatment is concerned, the treatment is by and large conservative, which includes giving NSAIDs for a short duration of time. You can give, in some scenario, you can give a wrist extension splint. In some scenario, you will like to reduce the activity, reduce the repetitive activity, reduce the work if the patient is a manual labor. Occasionally, if the pain is not subsiding with all these activities, you can consider giving local injections. Now, number of local injections can be tried. The one most commonly used is steroid injections. You can also try what is called as a prolotherapy. You can try a PRP injection. In some restricted circumstances, extracorporeal shortwave therapy (ESWL) may also work, and occasionally dry needling also works. So these are all the different parameters which can be used to treat a medial epicondylitis. Very rarely you might need to do a surgical intervention, which is actually the debridement and a sort of a little bit of medial epicondylectomy. This is a very rare surgery that we perform. This is more a surgery of exception than of a routine. Also, we also perform a surgery which is called as a Fitard surgery, which is called as a facial elevation and extensor origin resection. So that Fitard surgery can also be done in very rare cases which have intractable pain which is not responding to a conservative management. So friends, if you have pain on the medial side of the elbow, it can be a medial epicondylitis, and if you have any questions related to that, you may contact us on the comment box. Also, I would like to emphasize here that this problem must also be distinguished from a cubital tunnel syndrome, which is also, the pain is on the same side, but cubital tunnel syndrome is accompanied by numbness in the hand, whereas this medial epicondylitis is a pure pain syndrome without any numbness. Thank you.